My name's Gavin Richards and this is Michael Flower. We're two of the SHOs at the Royal United Hospital in Bath, and we've begun a project to improve communication using an SBAR tool. So Mike, would you be able to tell us first of all what problems the project aims to address?
Well, everything we do in the hospital depends on communication, whether it's communication between nurses, from nurses to doctors, or between doctors and other doctors, physiotherapists and occupational therapists. Between all of these conversations, we need to get the key aspects of patients' care across in a succinct and safe way. And as SHOs, we all know just how many calls we get, and we get called every few minutes when we're on call. And we also know just how many mistakes are made. So it might be the person who's receiving the call, it might be the person who's giving the call, but either way, we know that not all the information gets passed on, and it's patient safety at stake here. Imagine this was the aviation industry. Do you think a situation like that would happen? So can you imagine a pilot turning up, 10 minutes late for a flight and just jumping out and shouting, "So where are we off to today?" "Barcelona, is it? We got enough fuel?" "I don't know." "Which direction is it again?" "Can't really remember." Can you imagine turning up to a situation you've been called by the F1 to come and review? You don't know who the patient is because they didn't tell you. You don't know the background of the patient because that information wasn't relayed to you on the phone. You don't know what their assessment is, what their early warning score is, for example. But there is a solution, and it's simple and it's easy, and everyone knows about it. It's called SBAR. That stands for Situation, Background, Assessment, and Recommendation. It's a simple tool that we can use to structure our conversations, to streamline them. It allows people to get across the relevant information. It allows people to be assertive and make their own assessment and be clear. So the question is, if we've got this wonderful tool, why isn't it being used? And that's what we wanted to address with this project. How do we change the culture of an organisation? So first off, we looked at how many people actually knew about SBAR. Do people know about it? We found out that actually, yes, most people do know about it. And we collected some baseline data and found out, as we'd expected from our experience, actually no one is using SBAR at the moment. And the next question we asked ourselves is why? Why aren't they using SBAR and how can we change it? And we found out from the head of quality improvement in our hospital that she'd done quite a lot of work and there was a lot of paraphernalia, a lot of stationery available to us. We looked at the research, and there were quite a few groups, including some in Australia, who found really good evidence for SBAR and found that introducing it can cut down, makes conversations much more succinct but much more effective for both the people who are giving the handover, and the people who are receiving it. We examined the nursing handover, so looking at patients' journeys from when they come in through the door, through the emergency department, and into the medical or surgical assessment units and out onto the wards. And there were a myriad of different forms that people were filling out, nursing handovers, independent ones on every different ward, none of which were based on SBAR, and none of which encouraged anyone to use an SBAR format when they hand over. So we liaised with the head of quality improvement, and we redesigned a nursing handover form in SBAR format. We spoke to the heads of the departments, of every department, and we spoke to our seniors as well, and we're really, really pleased to see that they were really keen to support us. They supported our form and it's now out there, it's being used on every ward. And the next thing we did is we designed a sticker, a very prominent sticker, prompting in a very short and succinct fashion what SBAR is and how people should be using it. And we stuck the sticker on every phone within the relevant areas so that people had it there when they're making these phone calls as a prompt. We needed to inform everyone about what we wanted to do. So we designed a teaching session, but we wanted it to be novel. So we became amateur actors and we filmed. We made 2 films based loosely on conversations and handovers that we've all had as SHOs. There was a bad one from an F1 to a senior, which didn't use the SBAR format. And then there was a good one which did use it. The bad one, essentially, focused on one small aspect of a patient's care and missed the bigger picture about them being very septic and very unwell. The good one automatically included that information because they'd included the background and assessment and a recommendation. It quickly became clear to the SHO that this was a very sick patient who needed to be reviewed quickly. We're in the process of teaching all of the staff in the relevant areas, including nursing and medical staff. And once we've done that, stage will be set for our final intervention, which is going to be actually using SBAR. So, and we're, as SHOs, in a very useful position. We accept these handovers and we can initially prompt people to be using it, and ultimately really only accept a handover if it's an SBAR. And there's no excuse, because there's the tool right in front of you on the telephone. And throughout all of this, throughout all these interventions, we're collecting data on a run chart. All the SHOs, for every call that they receive, are collecting data. So we can follow our interventions and change course if we need to.
Good. What are the benefits to patient care from this?
Well, imagine this, that all communication in the hospital between nurses, between doctors, between physios and occupational therapists is all structured in a succinct fashion. SBAR will empower people to get across their assessment. It will make people take responsibility for their patients, and communication will be safer. Because if you apply common sense and you take our experience, there are mistakes being made. If we can reduce those mistakes, we can reduce the number of mistakes with a structured communication tool, we can save patients' lives.
And on the way through this project, what problems did you encounter and how did you overcome them?
Well, really the biggest problem that we found was that everyone knows about SBAR. It's a very good tool, but no one uses it. How do we change the culture in this organisation? Well, we used a combination of teaching, visual prompts and endorsement from seniors, and ultimately, probably most importantly, leading by example to change the culture of it and the inertia of this huge organisation. We learned that there's a lot of goodwill out there. We learned that senior management are really supportive, and it's been really encouraging because everyone we've talked to has been very supportive of our project. We learned that actually there's a lot out there. There's a lot been done on SBAR. It's just not filtered through to the front line yet, and that's what we're trying to do. Mm-hmm. Let me turn the tables on you.
Okay.
What have you learned personally from this project?
Well, I think we've all received the sort of phone calls that we're talking about here that are frustrating and frankly time-consuming because they don't contain all the information that you need in a succinct format for you to be able to process it, look at it in terms of your existing workload and prioritise appropriately. It's enormously frustrating. So that's certainly one thing that we're all keen to get out of this project. Ultimately, we are all interested in doing the best job we can for our patients.